The first muscle we're going to look at is the group of pectoral muscles. The pectoralis, or pec major, lies on the anterior thoracic wall. Knowing the names of the two heads, the clavicular and sternocostal, will tell you the proximal attachments. Its insertion point is the lateral lip of the bicipital groove. This is a good time to explain the bicipital or intertubercular groove. It's called the intertubercular groove because it lies between the greater and lesser tubercles of the humerus. More commonly, it's called the bicipital groove because the long head of the bicep tendon lies in it. The bicipital groove is isolated or located on the lateral side of the humerus and has three parts: the lateral or anterior lip, the medial or posterior lip, and a floor, and the specific muscles insert to each one of these parts. You know already that the pectoralis major inserts into the lateral lip. We'll see the others in due course. Now, before a muscle can act, it must also be stretched. So let's see what happens with the pectoralis major as it contracts and is stretched away from the body. It will adduct or bring the arm closer to the body. Because its origin is anterior to the humerus, it will flex the arm or bring it forward and then will medially rotate the arm because it's inserted to the lateral side of the humerus. When you're trying to determine the action of any muscles, you need to think about it in this way. You can make the pectoralis major stand out by putting your hand on your hip and pressing. You'll feel two large muscle masses, one anterior and one posterior to your axilla or armpit. The anterior muscle is the pec major. We'll see in a little bit what the posterior muscle mass is. Now, it's interesting to illustrate using the bench press how the two parts of the pectoralis major can act relatively independently. The lower the bench, the more the sternocostal part of the pecs is activated. The higher the bench, but there is a limit, the more you use the upper or clavicular part of the pecs. If the bench were vertical, you'd use another muscle, the deltoid. When the bench is somewhere between 30 degrees and 45 degrees, you use a muscle that lies between the lower pec and the deltoid, and that is the upper clavicular part of the pec. It's most likely that you use the anterior part of the deltoid at 45 degrees and the clavicular head of the pec major at around 30 degrees. Although these two heads can be tested independently, at this point you only need to confirm that the entire muscle can both flex and adduct. To do this, place your patient's arm in a slightly abducted position and ask them to push anteriorly for flexion or towards the midline for adduction against your resistance. Of course, these actions are performed by other muscles as well, so you want to be able to observe and palpate the specific muscles you're testing, i.e. in this case the pecs, and compare the strength to the other side. You have to always compare to the other side to determine strength and function.
So for the next test, we're going to be looking at the pectoralis major muscle. In your text, that's differentiated into a clavicular and a sternocostal kind of division of the muscle. Clinically speaking, we rarely differentiate between these two, but we can show you both in the meantime. And what we'll do, we'll have the patient have the arm out to the side, like so, and we're resisting straight horizontal adduction. So pulling against me here, stabilizing on the scapula on the back, and then relax. That would be more for the clavicular head, and then at 60 degrees would be more for the sternocostal head. Pull, 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 and relax.